Hi, this is Dr. Christopher Maloney, naturopathic doctor. I want to tell you a little bit about my practice. What I generally do is I act as a backdrop to primary care physicians in the emergency room situation. The majority of my patients are chronically ill. They have a variety of medications that may help to some extent but haven't resolved their situation to their effect, to their what they'd like. And I have a number of other patients who don't want to take medication or for whom medication they're allergic to it. So most of my practice is based around conventional medicine, and I generally do the pickup and the cleanup, and I take the cases that conventional doctors won't treat. So as a result, I have to spend a lot more time looking into cases. I have to also spend a lot more time researching individual cases. I'm very good at difficult or impossible situations because I will continuously look at how we can improve despite the diagnosis, how we can improve despite the circumstances. My goal is to work for my patients. I work for you. I don't work for an insurance company. And as such, my obligations are entirely to you. I don't have to shorten my visits. I don't have to keep to their, I don't have to live by a code of the insurance company. I live by a code of honor with my patients and a code of confidentiality with my patients. For the most part, if you come to see me, no one knows you've come to see me. I'm not part of a larger system of healthcare. I also will talk to your conventional doctors, and I will gladly share information with them if you wish me to. Many of my patients choose to not have me do so because they conventional doctors are somehow opposed to what I do, even though what I do is overwhelmingly lifestyle, diet, supportive of their treatments. And as a result, for the most part, my practice is based on that patient confidentiality. I also spend a great deal of time working with individual patients. First visit is usually an hour and a half. It usually goes to 2 hours. We usually spend about 2 hours, and most patients are surprised at the length of time and the ability for them to fill this space, and also the number of healthcare complaints that they actually have that they have simply put to the side because no one else would either listen to it or thought it was important enough to address. And when I'm doing something with a patient, I'll find that oftentimes the thing that they've come in for is secondary to a thing that they've given up on. And I'm usually effective at helping both of those. I like to see the whole person. I like to deal with that whole person's situation, which means listening to all of your strange, odd, and curious complaints and treating them effectively. So for the most part, patients find me very, very helpful in a very different way than a primary care physician. I can act as a primary care physician if you're very, very comfortable being independent and not needing immediate responses. As an acute care, I sometimes am right there for you. Other times I'm working with my family, I have to deal with them. I am the primary family caregiver at this point as well, so my time is very limited. And as a result, I don't recommend that patients only use me, that they have a variety of healthcare practitioners, both conventional and alternative, that they have access to. And yet I often find that patients who are most satisfied when they come to see me, and they'll bring their family members in to see me because the results that we're getting, because we put the time in to come up with those results, are very, very effective and ultimately very, very cost effective and life changing. So that in a nutshell is my practice.